Okay, we're back. This is lesson 2. We're going to talk about cardiac emergency and CPR. Remember, you do not have a note packet, so if you need to take notes, grab a piece of paper or use the one used for lesson 1 to write down important parts. Okay, I'm going to tell you now that CPR has some important steps that you need to write down: hand placement, shoulders, where your shoulders are at, positions on where you need to be. Okay, so we're going to go ahead and I'll probably have to move this again. So we'll put this down here somewhere, and then boom, let's get started. Get this over here out of the way. Okay. Signs and symptoms of a heart attack. Now, before I get started and forget, because I'm old and I tend to forget stuff, there's a difference between heart attack and cardiac arrest. Okay, and it's simple. Heart attack is a stop. Blood flow is stopped, or blocked, and can't get to the heart. So blocked blood flow is a heart attack. Cardiac arrest is your heart stops working. It stops. It doesn't beat anymore. Okay, so the difference is heart attack, blocked blood flow to the heart. Cardiac arrest, your heart is stopped beating. Okay, here is some signs and symptoms of a heart attack. And the interesting thing about signs and symptoms is that they can be different from male to female, and it can be different from first time to the second time. Like if you have one heart attack, you may feel certain things. There may be certain signs and symptoms, and then the second one you have could be completely different. Okay, so that's what makes heart attacks a little tricky. All right, here we go.
Being able to recognize when a person is having a heart attack can be a life-saving skill. Signs and symptoms of a heart attack vary from person to person and can be different in women than they are in men. Even people who have had a heart attack before may not have the same signs and symptoms with a second heart attack. Chest pain, pressure, and discomfort are the classic signs of a heart attack. The pain can range from mild. The person might describe the pain as tightening, squeezing, or severe pressure. The pain may last longer than 3 to 5 minutes or go away and then come back. Although the pain may feel similar to that of a muscle spasm or indigestion, resting or taking medication does not relieve the pain. The pain may spread to one or both arms, the back, the upper part of the stomach, or the neck and jaw. The person's appearance and behavior may also offer clues. The person's skin may look pale or slightly grayish or bluish, and the person may be sweating heavily. The person may be having trouble breathing and feel short of breath. Some people become dizzy or lightheaded, or feel nauseous or vomit. Others may become unresponsive. Many people who have had a heart attack say that they felt anxious, like something really bad was happening. Others describe feeling unusually tired for a period of time leading up to the heart attack. Trust your instincts and seek advanced medical care immediately when you recognize the signs and symptoms of a heart attack.
Okay. Heart attacks, obviously, there we go. This is a call first emergency, so you suspect a heart attack, you're calling 911. Reason being is that time is of the essence. The faster you get them help, more likely they survive a heart attack. Boom. Okay, so what happened? This is an unconscious check. Okay, the last lesson you did a check of a responsive person, so they were conscious, they were awake for it. This is going to be an unconscious check. So you approach the person, check the scene, make sure it is safe for you to enter. You ask the person, are you okay? Okay, if you know their name, use their name. Jackie, are you okay? Jackie. Jackie, come here. Say hi to the kids. Come on. There, see? Responsive. Came when he was called. Nothing's wrong. He's happy. Look at his face. Here, give you a, so you're not looking at him. Look. Okay, he's my teaching assistant. This is Jackie. So he's awake. Okay, Jax is alive, which is good. A lot of laughs. Now, if he didn't respond, I would have implied consent. But because he was responsive, I could say, Jackie, can I help you? And he would probably go woof, okay? Because he can't say hi. Yeah, he can't say yes. So nevertheless, if they're responsive, the person's going to say, yeah, you can help. If they're not, you have implied consent, assuming that person would want help if they were awake, okay? Send somebody to call 911. Be firm. Use your communication skills you learned in the first unit. Be firm. Don't be all quiet. Will you please call 911? No. Call 911 and then get back to your stuff, okay? Roll the victim over. If you need help with that, let us know, and we will show you how to roll a person over, okay? I might even have Dadis throw a video up on Schoology for you to see that, okay? You're going to do head chin tilt, okay? You'll see that in the video, the head chin tilt, and then you're going to be real close to their mouth, okay? You're going to turn your face sideways so that their mouth is right here and their nose. You're going to be looking down toward their feet, okay? So you want to see their feet. And what you're going to do is you're listening for any wheezing, okay? Any sounds they make when they breathe. You're trying to feel on your cheek any breathing, any air coming out of their mouth. And then you're looking down toward their feet because you want to see if their chest will rise when they breathe, okay? Because if you inhale, your chest will move. Make sense? So you're going to do that for no more than 10 seconds. So it's 5 to 10 seconds. Got it? All right, moving on. All righty, the cardiac chain of survival. You are going to have to watch. We're going to watch this one. I think it's this one. We're going to watch this one. This one should have both the adult and the child, the pediatric. Okay, there are 2 different ones. One's an adult and one's a pediatric. Okay, the only thing that changes is the first 3 steps. Okay, makes sense? This you may want to write down, but otherwise, if you can remember it, great. Here we go. Uh-oh. Hey, all right.
When a person is in cardiac arrest, quick action is crucial. The cardiac chain of survival describes 5 actions
Don't worry.
that, when taken,
We're going to talk
increase a
about it
person's
individually.
likelihood of surviving cardiac arrest. You have a major role in completing the first 3 actions. There is a cardiac chain of survival for adults and one for children and infants. Let's look at the adult cardiac chain of survival first. The first link in the cardiac chain of survival for adults is recognition of cardiac arrest and activation of the Emergency Medical Services EMS system. The sooner you recognize that a person is in cardiac arrest and call 911 or the designated emergency number, the sooner advanced medical personnel will arrive. Early CPR is the second link. CPR helps to circulate oxygen-containing blood to the brain and other vital organs, helping to prevent brain damage and death. The third link is early defibrillation. The electrical shock delivered by an AED may restore an effective heart rhythm, significantly increasing the person's chances for survival. The fourth link is early advanced life support, which is provided by EMS personnel at the scene and on the way to the hospital. Integrated post-cardiac arrest care is the final link. After the person is resuscitated, an interdisciplinary team of medical professionals works to stabilize the person's medical condition, minimize complications, and diagnose and treat the underlying cause of the cardiac arrest. The pediatric cardiac chain of survival is slightly different from the adult cardiac chain of survival. Because cardiac arrest in children often occurs as the result of a preventable injury, such as trauma, drowning, choking, or electrocution, Prevention is the first link in the pediatric cardiac chain of survival. The second link is early CPR, and the third link is activation of the EMS system. Just as in the cardiac chain of survival for adults, the fourth and fifth links are early advanced life support and integrated post-cardiac arrest care. 4 out of every 5 cardiac arrests in the United States occur outside of the hospital. When you complete the first 3 links in the cardiac chain of survival, recognizing cardiac arrest and activating the EMS system, immediately beginning CPR, and using an AED as soon as possible, you can make the difference between life and death for an adult, child, or infant in cardiac arrest.
All right, we're going to go through this again real quick. I want to point out a couple things. We'll stop at
when a
1
person
second.
is in cardiac arrest, quick action have a major role in.
Okay, so we're going to move this so you can see. Adult cardiac chain. The first step, recognizing emergency and call 911, just put call 911. Don't make this any more difficult than it needs to be. Call 911 is step 1. Step 2 is early CPR, pretty easy. Step 3, okay, you're in 7th grade. I'm 100,000 years old. I still can't say defibrillator, all right? AED, simple, AED, okay? Now, since we're talking AED, and I'm gonna remind you when we get to the AED portion of this, think about your school building. Where do you think that AED is located? Some of you may know this already, which is great. Some of you may not even notice it's sitting there. You go by it every day you're at school. Every day, at least one time. Okay? Any ideas? We're waiting for it. Dramatic pause. It's by the cafeteria. If you're walking in the cafeteria, it's going to be that little box on the wall to your left, right underneath the Baron Pride Award winners for the quarter. Okay? That's where it's at. And we'll talk more about that the next time when we talk AED. Okay? So step 1 is call 911. Don't make it difficult. Step 2, early CPR. Step 3, AED. Easy. Step 4, advanced life support would be EMS or ambulance. Don't make it hard. And then the integrated post care is seeing a doctor. See doctor. That's it. Those are the 5. You put that down on a test, Datus and I are giving you credit for it. Okay, does that make sense? Easy. Don't make this hard. All right, moving on. Oh, probably should do the, and that applies for the kid one too. Did I go too far? It's prevention, CPR, 911, EMS, and see a doctor. Go back. All right, cool. We're good. All right, so now we're going to talk CPR. So I got to move my face again. Hope I don't make you guys dizzy. I put you right in the middle of the screen just because, you know, you want to see my beautiful face right in the middle of the screen. CPR. Okay, so we're going to watch a video on CPR. I believe the next slide will be a practice. This is going to be your activity for lesson 2. You're going to do CPR. So take notes if you need to take notes. Okay, hands, what they're supposed to look like, where your hands are supposed to be, how deep you're supposed to go, where your shoulders are lining up, how fast. It's quick. You're moving quick. 1 and 2 and 3 and 4 and 5, 6. Quick. Boom, boom, boom. Okay. So CPR, you're going to do the unconscious person check. So the unconscious check, because they're out, their heart stopped, they're dead. They're not going to talk to you. Okay, make sense? All right, so you go through that. Then you're going to do 30 compressions. So you unconscious check, make sure you're checking their breathing, 5-10 seconds, making sure they're on their back, a firm, flat surface. You can't do this on a bed. Can't do this on a couch. Can't do this in a pool. Okay, it has to. You can't do this on a table. Okay, I get that one a lot in the classroom because people don't want to get on that concrete floor. On the floor. So your person's on the floor, out, they're dead. Heart's not working, they're dead. They're not breathing, they're dead. Okay? 30 compressions, and they're quick and deep. You get to 30, you're going to tilt the head, and they'll show you in this video. I don't have a mannequin here, so I can't really tilt the head. I don't even have a rotten child here to sit there still and do their head. Okay? My dog, I tried it the other day for the 8th graders. He wasn't having it. Okay? So they'll show it to you in the video. Don't use your dogs because your dogs ain't going to like it. Okay? So you got your 30 compressions. You're going to do 2 breaths. Okay? While you're doing the breaths, your mouth is going to enclose there. So you got to make a seal with your lips. There's a breathing barrier. Okay? Don't just kiss the person. There's a breathing barrier you put over to protect you from the person. Then you seal it with your lips. Okay? It's different with an infant. I'm going to show you that video. Okay? Then you do 2 breaths. While you're breathing, you blow one in, you're looking down toward their feet because you want to see their chest rise. If their chest doesn't rise, then you need to re-tilt their head to reopen that airway and give another breath. Okay? Now, if the chest still doesn't rise, then you have to assume that there's something lodged in their throat. So they're not only dead, they're choking. Okay? And we'll talk more. The compressions are going to help bring that up. So then you're going to have to look in their mouth to see. Okay? So you give your 2 breaths. The breaths go in 30 compressions. After your 2 breaths, you're doing 30 compressions. Do it again. Then 2 breaths, 30 compressions. 2 breaths, 30 compressions. 2 breaths, 30 compressions. The rate you're trying to go is 5 minutes or 5 cycles in 2 minutes. So you're moving quick. You want to compress their chest at least 2 inches. A child is 1.5 to 2 inches. An infant is 1.5 inches. Okay? And an infant's a little bit different. So 32, 32. Don't get confused with once you get 5 cycles done, you're done. That's not right. The 5 cycles in 2 minutes is how fast you need to be doing them. Okay, does that make sense? You don't stop for any reason. You keep going. Okay? You understand? Not if you understand, like I'm going to see that. Anyway, there are 5 reasons. Can you see my fat hand here? Look, there we go. 5 reasons you can stop CPR. That should be coming up here soon. All right, let me see before we start. All right, so you're not allowed to stop until you get to these 5 reasons. These are the only 5 reasons you stop, because remember, they're dead. They're dead. If you stop, they're dead. Okay? So as long as you keep going, you are the pump. You are the heart pumping the blood throughout their body so they can make it from the time they had their cardiac arrest till when the EMS team gets there. Okay? You're that bridge. The only reasons you can stop, the ambulance arrives, somebody more qualified than you takes over. The AED is ready to use. Now, if you look down here, this is an AED. Okay, boom, boom. It's like the 1, 2, 3 shock you see on the movies. Shock. It's just a smaller version. Okay, so, and don't panic about this. This is simple. So simple. Simple. Okay, we'll talk about that. So, AED is ready to use. That's another reason you can stop. And you're not really stopping. You're following the directions that the AED tells you. Yes, the AED talks. Okay, I'm not crazy, it does. The scene becomes unsafe. So now the scene is unsafe for you to provide adequate care. You can stop. You are too tired to continue. Now, let's clarify too tired. Okay, for me, it's 9 o'clock. I've been working on school stuff since 2:30. About now is about nap time. I'm kind of tired. I don't want to do this anymore. Or like you, when you come to my classroom, okay? Or now that you're not in school, you sleep until noon. Okay, and you get up, I'm too tired. No, that's not it. Or you athletes who have practice and you're conditioning. Too tired. That's not it. You stop. Too tired here means you are absolutely 100% done. Like you are so exhausted that you are done. Can't do it anymore. Okay? At all. Can't do it anymore. That you can stop. Because remember, once you tell yourself, I'm too tired to do this anymore, you are done. That person is dead. Has no chance. Okay, does that make sense? You're the heart. You have to pump that blood because their heart's not working. Make sense? Cool. Or the person shows signs of life. So they open up their eyes. They scream. They make weird sounds. I don't know. Never seen somebody come back to life. So I don't know exactly what they're going to say. But obvious signs of life. They start moving. They wake up. Okay, some sort of sound. Those are the 5 reasons that you can stop. So now we're going to go backwards a little bit so I can show you this video. And you're going to be stuck here for a little bit because there's, I think, 4 videos off the rip, okay? So here we go. Let me move my face over here because you don't need to see this much. And here we go.
Hey, are you okay?
Oh, you sneaky little booger.
Hey, are you okay?
After confirming that someone is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR.
He's unresponsive. Go call
Ensure the person is on his back on a firm, flat surface such as the ground. Next, kneel beside him and place the heel of one hand in the center of his chest, with your other hand on top. Interlace your fingers and make sure they are up off the chest. Position your body so that your shoulders are directly over your hands. With this technique, you can use your body weight to help compress the chest. Now, give 30 chest compressions.
1 and
Keeping
2
your
and
arms
3
straight,
and 4
push
and
down
5
at
and 6
least
and
2
7
inches,
and 8
then let
and
the
9
chest
and
return to
10
its normal
12
position.
13
Continue to
14
push
15
hard and
16
fast,
17
giving
18
compressions
19
at a rate of between 100 and 120 compressions per minute.
17 18 19 30.
Next, give 2 rescue breaths.
Okay.
First, place a breathing barrier over the person's nose and mouth. Then, open the airway by putting one hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a pass-neutral position. Pinch the nose shut, take a normal breath, and make a complete seal over the person's mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath.
1 and 2
Continue
and
giving
3
sets of
and 4
30
and
chest
5 and
compressions
6
and 2 rescue breaths until you notice an obvious sign of life. An AED is ready to use and no other trained responders are available. You have performed 5 sets of CPR and another trained responder is available to switch. EMS personnel take over. You are alone and too tired to continue, or the scene becomes unsafe.
Okay, so they showed you how to open the airway. Okay, hand on the forehead, on the chin, and you lift their head. Now our mannequins have a flat spot on the back so you can learn how far back you can go. But in real life, you need to, boom, you need to do it. You're not going to know. You just have to have a feel. And then when you give the breath, the chest should rise. If it doesn't rise, do it again because it may not be far, their head may not be far enough back to open that airway. Okay? Then you got to close the nose before you put your mouth on there so that when you breathe, the air just doesn't come out of the nose. You want the air to go into the lungs. Okay? When we watch the infant one, that's going to be a little bit different. Okay? Then they talk about where your hands are supposed to be in the middle of the chest. you want the, let's see if I get this on the screen. You want this part of the hand in the middle of the chest. So the heel. And then your fingers need to be up. Okay? I don't know if you can see that. It's going to be up. Okay? And I'll show you that when we do the activity. Your shoulders need to be directly over your hand. The nice thing about making video demonstrations is I can easily see if your shoulders are too far back. You will easily see if your shoulders are too far back because then your arm will be at an angle. Okay, makes sense? You want it straight up and down. All right, so kid one. Let's do the kid one, maybe. Boom. All right, quit being stubborn. There we go. Adult and child. The child is going to be the same as the adult. And got a ball. Jackie wants to play, so we're going to do a little multitasking. Okay, the child is going to be the same as the adult, so we're not going to watch that video. If you want to see it, email me, let me know. I'll put a link up on Schoology for that video, but we're going to skip it. Oh, okay, so here's the practice time. This is going to be the infant one. We'll do that after the practice one. I want to put this practice up here so you can practice because, again, this is the activity that you're going to do for this lesson, okay? And we'll get to that. You may not be able to have the practice on there. You guys are a little more tech savvy than me, so you might be able to figure that out. But here we go. And then you'll practice. Now, how are you going to practice? You'll be like, Mr. McAllister, I ain't got a dummy around here. Now, some of you may say, well, my brother and sister are my dummies. Okay, don't do this on them. Okay, don't do this on your dog. They won't like it. Trust me, I tried. Okay, get a stuffed animal if you have one. You can use a pillow or cushion. You can get a Bosu ball, and a Bosu ball is like those blue resistor balls. If you've seen my chair in the classroom, that ball that sits on there, if you cut that in half and put it on a flat surface, that would be a Bosu ball. But I'll show you that before your activity. Because if you have one of those around, those are great because there's a nice big center in it for you can pretend as a chest, but there's a lot of bounce to it, so it kind of throws you off. But nevertheless, find some, be creative. You can just use the floor if you want, as long as you practice, or as long as you can do the skill to the point we can see it via video, okay? And so it's not hard. Be creative. We're not going to beat you up about it, but here we go. This is your practice.
Okay, it's your turn to practice 5 cycles of chest compressions and rescue breaths. Begin by kneeling beside your mannequin with your gloves on and your breathing barrier nearby. Next, place your hands on the center of the mannequin's chest. Make sure your fingers are interlaced and off the mannequin's chest. Your shoulders are directly over your hands and your arms are straight. Count out loud and keep pace with the metronome while giving 30 compressions. Ready? Begin.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 5, 6, 7, 8, 9, 30.
Good. Now place the breathing barrier and open the airway. Pinch the nose, make a seal, and give 2 rescue breaths. Immediately give another 30 chest compressions. Remember, compress at a rate of 100 to 120 compressions per minute, and a depth of at least 2 inches for an adult. For a child, compress at a depth of about 2 inches. Great job. Now, open the airway and give 2 rescue breaths. Now back to chest compressions.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16.
Remember,
18,
push hard and fast.
1, 2, 3, 4, 5, 6, 7, 8, 9, 30.
You You got this. Okay, 2 more rescue breaths. Keep going. Give another set of 30 compressions and 2 rescue breaths.
7 and 8 and 9 and 10 and 11 and 12, 13.
Remember, allow the chest to return to its normal position after each compression.
22, 23, 24, 25, 26, 27, 28, 29, 30.
Last set of compressions.
4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25.
You're almost there. Finish with 2 rescue breaths. Good. You can now take a rest.
Okay, now remember, you're not doing 5 sets in 2 minutes. That's the pace you want to go. Okay, in a real life situation, you're not stopping. So if you do 5 rounds and EMS isn't there, guess what? You're doing 6, and then you're doing 7, then you're doing 8. Just don't think you're going to stop then. In a training situation, 5 sets in 2 minutes is fine. Okay, so that's practice. Okay, if you need to see it again, back this video up and watch it again. Okay, practice as much as you want. All right, now I'm going to show you this infant one. Now the infant one is going to be practice as well, but you don't have to practice this one. If you want to, you can. This one's up to you. It doesn't matter, but there's differences that I want you to see. Okay, and I'll point them out when they come up. Oh, let's get this started.
Okay, it's your turn to practice 5 sets of chest compressions and rescue breaths for an infant. Begin by kneeling beside your infant mannequin with your gloves on and your breathing barrier nearby. Next, place 2 fingers on the breastbone just below the nipple line with your hand closest.
Okay, remember, 2 fingers on right where the nipple lines are. Okay, 2 fingers. You're not using the heel of your hand because most likely your hand's going to cover their whole midsection. Okay, depending on how small the baby is. Okay, you got two fingers on the nipple line. You have a hand on their head. Okay, that hand is keeping their airway open. Okay, you with me? All right.
To the infant's feet. Count out loud and keep pace with the metronome while giving 30 compressions. Ready? Begin.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 28, 29, 30.
Good. Now place the breathing barrier and open the airway to a neutral position. Make a complete seal over the mannequin's
Okay, here it is.
nose and mouth with your mouth.
Did you hear it?
Give 2 breaths.
You're putting your mouth over both mouth and nose of the baby because
Immediately give another 30 chest compressions.
their mouth
Remember, compress at a rate of 100 to 120 compressions per minute and a depth of about 1.5 inches.
their mouth is so small that your mouth will go over both the nose
Great
and
job.
their mouth.
Now, open the airway and give 2 rescue breaths. Now, back to chest compressions.
3 and 4 and 5 and 6 and 7 and 8 and 9 and
Remember, push hard and fast.
14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26.
You got this. Okay, 2 more rescue breaths. Keep going. Give another set of 30 compressions and 2 rescue breaths. Remember, allow the chest to return to its normal position after each compression.
30.
Last set of compressions. You're almost there.
And 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Finish with 2 rescue breaths. Good. You can now take a rest.
Okay. Jackie wanted a little attention, apparently. A couple things in that video. I wanted you to see 2 fingers in the center of the baby's chest, at the nipple line, and then you're covering both the infant's nose and mouth with your mouth to give breaths. Okay. Cool. Moving on. That one you don't have to practice unless you want to. Is that it? I don't think that's it. There we go. Okay, now, if you give your 2 breaths, the chest does not rise. We're going to do this one. Okay, then you have to assume that the person is now choking. Okay, so now you have to get that object out of their mouth. Okay, and I think I want to see the next slide, if the next slide has a baby or if this is all. Okay, cool. So this one's probably the baby. Now the baby again is different because its mouth is small. Sorry, call time. Okay, so pay attention to this video. Boom. Now, when we do this, maybe not. That's a minute and a
When
half.
giving breaths, the chest should rise.
That's a minute and a half. Can I move this? Apparently not. What's this one? One thing to remember is when you start, first thing you're going to do is do your unconscious check. Then you're going to do your 30 compressions, then your 2 breaths. So when your 2 breaths don't go in, once you try it twice, you're going back to 30 compressions. Then you will do your head tilt. And before you breathe, you're going to look and see if you see an object in their mouth. Okay? Make sense? All right. Now, I know should explain that. I'll come back to it if they don't, so I don't confuse you. I think this might be it. We'll try this one. Nope, this one isn't it.
When giving breaths,
This one isn't it.
the chest should rise.
There we go. I want to use this one. Boom.
However, you might encounter a situation where the chest does not rise. If the chest does not rise on the first breath, reopen the airway, make a seal, and try a second breath. If the chest does not rise on the second breath, an object might be blocking the airway. Immediately begin the next set of chest compressions.
23, 24, 25.
Before attempting rescue breaths, open the mouth and look for an object. If you see an object, remove it with a finger sweep. For an adult, use your index finger.
Okay, this is important. For an adult, you're going to use, well, for a child probably too, you're going to use your index finger, that's your pointer. And you're going to stick it in your mouth and you're going to scoop it. You're going to make like a hook and you're going to scoop it. And if you get it out, great. If not, then you go back to your chest compressions, do another round, do it again. Okay, makes sense? You with me? Here we go. A baby's going to be a little bit different. They're going to talk about the baby. The baby, you'll use your pinky. Why? Because it's smaller. Why? Because their mouths are smaller. Okay, cool.
For a child or infant, use your little finger. Give 2 rescue breaths and continue CPR.
One and 2 and 3 and
Okay, get it? So a little bit of differences with the infant and versus the adult and the child, okay? Reason we're doing that is because some of you got baby brothers and baby sisters, some of you babysit, all that stuff, so that's good to know. And now I need to get out of here again. Boom. Okay, so now we are, let's see if we can just get over, there we go. Again, the 5 reasons to stop. Okay, EMS arrives, AED's ready to go, scene becomes unsafe for you, you are exhausted, can't physically continue, or the person shows signs of life. All right. Questions. If you have any specific questions, go to that flip grid question spot. Datus and I will answer them as soon as we get them. Maybe not as soon as we get them. I'll probably check it in the morning, so it'll be in the morning. You'll still be snoozing. I'll be up cracking out your answers, getting them ready to go. Okay. So your activity. Okay, your activity is going to be kind of, I hope, kind of fun. I'm going to do a demonstration in on the flip grid. Yes, you're making a flip grid video of CPR. I'll do a demonstration. Things that we're going to be looking for is your hand placement. So essentially, we're going to look for fingers up, because depending on what you use, we're not going to know if that's the center of the chest. Okay, so we want to see your fingers up, and we want to see your shoulders directly over your hand. So it should be a straight line. And you should, oh my